acetate or soap and the person is not seeing clearly, in such a case, we can use prisms to make the person see and read very well.
Standard. Yes, they have this problem, but it's not the end of the world. To be able to encourage them to maximize the little vision they have so that they can live independently, their daily activities they can carry on.
There is no age, there is no race, there is no gender. I have a case of a child that had chloroquine maculatus because he had malaria. He was given chloroquine injection and he has an issue with his macula. He became a low vision patient at 6 years old.
So Uwamarin Ogbebo, I'm an optometrist, and this month of September, it's important for us to inform you that it is our month of low vision awareness according to the Nigerian Optometric Association calendar. I'll be interviewing some low vision specialists to tell us more about low vision. My name is Dr. Uwamari. Can I meet you, please?
Okay, thank you very much. My name is Dr. Ngozo Tedius Onyechuku, a consultant low vision optometrist. I work with the Anambra State Ministry of Health, Nigeria.
Thank you so much, Dr. Jude. Also, now we want to learn about your field, your specialty, low vision. What is low vision?
Okay, low vision can be defined in various ways. It can define based on visual acuity. It can also define it based on function. Based on visual acuity, say low vision is when a patient has a visual acuity of less than or equal to 618 with the best correcting lenses in place. And now, in the better seeing eye. Also, when you define it based on function, you say when a patient has a vision that interferes with his or her activities of daily living in the better seeing eye with the best correcting lenses in place. So it can be defined based on visual acuity. It can still be defined based on function, because in functional area, your activities of daily living, your actual things you do are affected.
Oh, great. So that's so simplified. And we'd like to know the causes of low vision.
Okay. You can also look at the actual cause of low vision. Low vision can be caused by various things and myriads of things. It can be caused by trauma, can be caused by drugs you take, like cases of diabetes. When a patient has diabetes, retinopathy that affects the macula, the patient can get into low vision. When a person has hypertensive retinopathy, can affect the macula. Age-related macular degeneration also affects the macula. Uncorrected refractive error also can make the person go to low vision. Trauma also, even when surgeries go bad, also it can affect the patient. When the person has a retinitis pigmentosa, it can affect the patient. There are some people that have also some genetic inherited malfunction of their body system. Take for instance, people living with albinism. It is not a disease per se, but because they are living with albinism, they fall into low vision because their functions are affected, their visions are also affected. So a lot of things can cause low vision.
If I heard you clearly, most of the causes that you mentioned has to do with either genetics or acquired. Now, are there cases of congenital low vision? Can it come as a result of birth dysfunction?
Yes, it can come. Take for instance, the issue of albinism is a recessive gene inherited by the patient. Also, there are some people also that may have genetic malfunction of their body system, even while the patient is in the womb, and as a result, you will have cases of congenital cataracts also. Yes. If it is not well taken care of, the patient, at that point in time, the person becomes low vision. Even on cataract that has not been extracted, the person also is a low vision patient until it is extracted. The refractive error also. Most of refractive errors are inherited also. And so when it is not corrected, it can lead to low vision also.
Thank you so much. Please, can you give us a rundown of the signs and symptoms to watch out for low vision?
Okay. Low vision does not have a specific sign or symptom to say, look at. In fact, it is only the practitioner that can certify, the optometrist that can say this patient has gotten to this stage of low vision, because he has to examine him. There are many things you experience. The only thing you experience is that you experience that you will have a depreciation of your vision. That's why when you experience depreciation of vision, diminished vision, your vision is no longer as clear as it used to. It could be glaucoma, it could be anything. Go to your optometrist. The optometrist will examine you and now know whether your case is uncorrected refractive error that can be corrected, or even a case that has gone to low vision. But one thing is certain: when it got into low vision, it means that drops cannot handle it effectively. Corrective lenses cannot handle it effectively. Even surgeries cannot handle it effectively. As a result, the person becomes a low vision patient. There are cases whereby the person may be bedridden, immobile. The person cannot move his head due to accident or so, and the person is not seeing clearly. In such a case, we can use prisms to make the person see and read very well, even though his head is not turning. So it is the optometrist that will certify the person low vision. The patient does not have anything he sees to know he's a low vision person, only that he knows that he does not have a clear vision as he or she used to. So once you're experiencing diminished vision, get straight to the hospital. Ask for your optometrist. He will examine you and know what the cause of the diminished vision is. And if it's a low vision case, he will now refer you appropriately to the low vision specialist who will do what? Who will handle your case, and you will definitely be okay. One thing is certain: all hope is not lost. Once you come, we handle it, you have hope again. Even if it is somebody that have gotten to blindness, we can rehabilitate you, teach you how to use Braille. You become okay. One thing is certain: in low vision, there is no loss of hope. There is still hope, even though you think all hope is lost. Thank you.
Thank you so much, Dr. Jude. All hope is not lost. It's also important for our viewers to know that you can be seeing very well today, and tomorrow you'll be a victim of low vision.
Yeah.
When you have any eye challenge, it's good for you to report to the hospital. It's good for you to see an optometrist. If you love your eyes, I'm sure you will not want to join the community of persons that are living with visual impairment.
And just like you said now, you notice that there is no age. There is no age. There is no race. There is no gender. I have a case of a child that had chloroquine hemoglobin because he had malaria. He was given chloroquine injection and he has an issue with his macula. He became a low vision patient at 6 years old. So there is no age, there is no race, there is no gender. It can happen to any person. Please make sure you get to your optometrist. They will determine whether you're a low vision case or not. And I bet you all hope is not lost. I repeat again. Thank you.
Thank you so much. That last information is very important, so we don't get to think that it's just the elderly that suffers from low vision. Even children can be affected, and irrespective of whether you are a man or whether you are a woman, you are at risk of being a low vision patient. So get your eyes tested today. Thank you.
Thank you.
My name is Dr. Uwamarin, and would like to meet you, sir.
I'm Dr. Kingsley Anozie, a low vision specialist.
Oh, beautiful. And we've been talking to Dr. Jude, and he has given us a lot of light into low vision. We want to continue with you by asking you, first of all, what are the prevention for low vision?
Yeah, the prevention for low vision is usually the hallmark is early detection of the cause of the low vision. Once you're able to detect the cause of the low vision at the earliest stages where it can be stopped, then this candidate or client will not progress to low vision. It will be able to be managed. So early detection of such diseases or defects which can lead to low vision will help in stopping progression to low vision.
Thank you so much. You've heard that from the expert himself. He said early detection is key. And so now we know that early detection is key, but there are some people already that are already suffering from low vision. What can we do to support them, to help them manage the sight that is left, if any is left? And is there any treatment regimen for low vision cases?
Yeah, like I mentioned, early detection, some of these diseases, even if you detect early, will still progress. But with the fact that it has been detected, then there will be a plan on how to manage and help these persons to live to the fullest, to be functional with the minimal vision they will have. One, the hallmark in low vision is we use optical devices, to improve the little vision that is remaining. And also we use other assistive devices which are non-optical as well to assist low vision patients. One of these we call magnifiers. We have magnifiers, the ones that you can use to enlarge the characters, and this will help the patient to be able to see. We have the telescopes which can help these patients to view distant objects and views and be able to perform. Some can use it to go and watch football to be able to be integrated into the society. You can use it to go for parties as well. Also, for the non-optical devices, there are canes, there are guide dogs that can help you. There are other modifications which can be done in your home, maybe like a rail and all that. And then in public spaces, there must be modification to suit low vision patients or people with subnormal vision. So these are the managements that can help in mitigating the adverse effect of low vision. And with this, when this is done, it will help these patients who are already dependent on people to be able to function independently. Some can still use it to function in their workplaces. Some low vision patients, when we have something like called a CCTV, it can help them to function in their offices to do their work normally like any other person. There are some computers, talking computers that you can use with that. It will help these patients to function well. Also, we have telescopes that are mounted on spectacles. With this, these persons can actually move around the environment and go about their normal daily duties. It will not cause much limitation, as it were, if these devices are not made available for these candidates. One of the major things as well, one is the psychological therapy in low vision. We need to be able to talk to these clients and let them understand that yes, they have this problem, but it's not the end of the world. To be able to encourage them to maximize the little vision they have so that they can live independently, their daily activities they can carry on, interact with their folks, go for social functions, not being withdrawn, because by the time they are left unattended to with psychotherapy, you see them, they'll slip into depression. Anxiety will increase. But when we manage them psychologically as well, letting them understand that no, you can still function, you can still be integrated in the society, these people will begin to function and they will become happy, and too much dependency on people to help them will reduce.
Oh, thank you so much, Dr. Kingsley. I've learned so much from you today. I've been opportune to come across someone that is a low vision patient, and his complaint was that the gadget happens to be too big on his face, and then it makes him look ugly. Are we expecting maybe is there a research on that it's going to merge this telescope or the spectacle mounted and low vision aids so become ultra thin, so that when they put it on, it feels like they're wearing the normal glasses, just like every other corrective lenses?
Yeah, advances in technology have been modifying the nature of these low vision aids. Before now, at least 10 years, 20 years back, low vision aids that you see are very bulky, and then you don't have these spectacle mounted telescopes, because it has to be handheld. But with advances now, we have spectacle mounted telescopes which are miniature. They are not as big. In fact, some of them looks more modern than the old glass prescriptions that people that have high myopia that you put on. This has been modified now, and then there are so many assistive devices which are very small that you can use to be able to do your activities both in your office and outdoor movement.
You've heard from Dr. Kingsley, and this has been very educative. We hope that persons that are living with visual impairments, either total or partial visual impairments, will also get to hear about this.